There's so much talk in our world right now about the health reform. Well, I love accurately assessing the use of the English language. And to reform something would suggest that the form exists to begin with, right? In other words, if the form never existed, there's no need to reform it. We're actually forming it, all right? So we talk in this country about a health reform. But think about it. The thing we call health insurance covers us if we have a tragedy or crisis. And once the crisis or the diagnosis is eliminated, it doesn't cover us anymore. So it's not really health insurance, it's crisis care insurance. It's insurance to cover tragedy or crisis. Misuse of the English language, one could easily argue or debate. It's at least a conversation. Well, bring that more clearly to the term health reform. In this nation, we know that somewhere around $2.8 trillion is spent within the healthcare system. It's been fact that 95% of those dollars are spent on the treatment of crisis intervention. So it doesn't take a rocket scientist to figure out we're not spending money on health care, we're spending money on crisis care. Therefore, the major construct, the foundations, the basis of thinking and behavior in our medical or allopathic systems are the treatment of disease, which is crisis care, not health care. So we don't have a health care system. So let's get simple. We can't have a health reform. When you get people who design sickness care to help government officials lead a health reform, they can't. It's not their frame of thinking, right? When a carpenter sees things, he sees them as either a nail because he carries a hammer or something to be cut because he carries a saw. That's how he sees the world. No one sees anything as it is. People see things as they are. If we truly want a health reform, we would have had a healthcare system. So the real issue here is to raise up ourselves. We need to reform us. So the only chance for a health reform in this nation or this world at large is for individuals to go through a self-reform, to reform your conduct. Not your health reform, your self-reform. Okay? And these are conversations we can get way too intellectual about. But let's face it, you're already in a healthcare provider's office if you're watching this. At least that was the intention of this film. And so you're already at a higher level of thinking because you're in a kind of doctor's office who doesn't just practice crisis intervention, right? Most of the world's professional athletes go to chiropractors and get adjusted, not when their backs or necks or whatever hurt. They do it because they play a better game in life. So regardless of the presence or absence of symptoms, they seek to receive care. So we want to make sure that you live that out and you don't just use chiropractic as a means to druglessly get out of pain. What a substandard use of something so vibrant that helps racehorses run faster races. It helps Lance Armstrongs and the like pedal better races. It makes football players play better games, not because we fix you, but you have an ability inside you to fix yourself that when adjusted plays at a higher level. When you get adjusted, you express more of you. You know, there was research done recently on 65-year-olds. They took, I believe it was 4,000 or 5,000 65-year-olds, and they studied them over 5 years of time. And during that time, they were having regular, ongoing chiropractic care, usually weekly visits, regardless of the presence or absence of symptoms. And what they discovered and published, and it has been undisputed, the findings have stood true to this day, was that people 65 years of age and older, when they had 5 years of nonstop chiropractic care, they ended up costing this country 39% of the national average of what was being spent on healthcare costs for the unadjusted people. They also utilized 50% of healthcare provider visits compared to the unadjusted people. Now, one could add all sorts of arguments. Well, maybe they were doing something else too. Maybe these people who get adjusted also drink more water. Okay, and your point is? Because people who get chiropractic care tend to be more thoughtful, I would argue more intelligent, but at least more thoughtful about doing things regardless of the presence or absence of symptoms. So what I bring to you today is the only chance our nation has for a health reform is if you and I choose to literally live the life of going through self-reform. How are you going to conduct yourself differently? And that means, first of all, just think about what you're saying. Think about the doctors you're choosing. You know, in an earlier film I did with you, we shared research that was done at the University of Chicago Hospital, and they were trying to understand why most people who come in and out of hospitals never end up a whole lot more healthy. They may end up dealing with their symptoms, but when they're tracked a year or 2 years later, they're not living any healthier. And what they discovered was the doctors that they saw admitted to 3 things. Number one, they really don't have time to work with people on healthcare issues. All right? It's crisis intervention. Number 2, they really don't have the intelligence or the training, the knowledge of what to teach or give to patients to get them to have a more adjusted life. All right? And thirdly, they really don't care. And from what I could read, that wasn't meant in a malicious way. What they meant by they don't care is the thing they care for is crisis intervention. So they don't really tend to care. Most doctors don't care about health care. They care about crisis care. They may call it a healthcare system, they may call themselves healthcare providers, but again, that's what we said in the opening, it's just misuse of the English language. All right? So they're crisis care providers, good people, and it's necessary. In fact, one day if we get to meet and we have the time, I'll share the story of how my oldest son, who's with us today, would not be with us today if not for crisis intervention. All right? But the fact is, what he received in that hospital was not health care. When he was unconscious for 26 days, he was not receiving health care. He was receiving crisis care, and thank God for that. But once we got out and they told us he'd be brain injured, he'd be unable to read and write to any high levels, and he'd certainly never be an athlete, that's when we knew that once the symptoms were gone, we were going to have to work on health care. And at this point, he's conquered way beyond what most children or, blossoming adults get to accomplish. So none of those things became true. If anything, he went to the other extreme of prosperous living. So what I share with you is a pursuit of your prosperous living. No human being sees the world as it is. They see it as they are. My hope is that with this conversation just now, you're raising up who you are, and therefore you see the world different. As the old saying goes, when you change the way you look at things, the things you look at change. As chiropractors and chiropractic patients, we look at things differently. We don't get adjusted to get rid of a backache or neck ache. We get adjusted because a person adjusted is better off with everything they deal with. So whether it's the research that gets you, whether it's the conversations with your chiropractic that gets you, all I ask of you is go forth and be informed. Make sure that you daily don't just get your body adjusted, get your thinking and behaviors adjusted, because the only chance for a health reform in this country is self-reform, and that means you and I. Welcome to that journey. I'm counting on you. And you can count on me that these are the things I lose sleep over, and so does your chiropractor. So also think of who is your family, friends, relatives, co-workers that should have heard this. Bring them on the next appointment and share this with them. Thank you.